Safety indexed connector systems are standardized connections for high and low pressure gas delivery sources that are used to reduce the risk of administering the wrong gas to the wrong patient. We created this video to cover the medical definition and provide a brief overview of this topic. So if you're ready, let's get into it. The distribution and regulation of medical gases is an important but often forgotten topic in the field of respiratory care. In general, oxygen delivery systems store medical gases at extremely high pressures. So before a gas can be administered to a patient, the pressure must be reduced to a safe and workable level. You should also know that administering the wrong gas to a patient is one of the biggest risks when it comes to medical gas therapy. This is why, as a respiratory therapist, you are required to read the cylinder or outlet label first before administering the gas. With that said, human error does occur, which is why safety indexed connector systems were created to help prevent misconnections between respiratory care equipment. The three most common examples include ASSS, PISS, and DISS. ASSS stands for the American Standard Safety System. This system is primarily used for high-pressure connections between the large gas cylinder sizes that range from size F through H and K. This applies to their attachments as well. This system uses unique threading and sizes, which makes misconnections very difficult so that the incorrect gas is not delivered to the wrong patient. PISS stands for the Pin Index Safety System. This connection type is actually a part of the American Standard Safety System, but it is primarily used for the high-pressure connections between the smaller gas cylinders from size E and under. The PISS system uses a yoke-type connection that utilizes different pin positions for each of the different types of gases. The pins and holes must align perfectly in order to secure a connection for gas delivery. This also prevents misconnections so that the incorrect gas is not delivered to the wrong patient. Then we have the DISS system, which stands for Diameter Index Safety System. This connection type is different from the ASSS and PISS because it is designed to prevent misconnections of low-pressure gas delivery sources. Just to give a reminder, the American and Pin Index Safety Systems are used for high-pressure gas delivery sources. The Diameter Index Safety System is used for low-pressure sources. The DISS is often used at the inlets of flow meters, ventilators, and other pneumatic respiratory care equipment. It's also used at the outlets of pressure-reducing valves that are attached to cylinders, and at the station outlets of central piping systems. This system uses unique external threading, which also makes misconnections very difficult so that the incorrect gas is not delivered to the wrong patient. I bet you're starting to recognize a pattern here. While each of the three systems are unique, the goal of each is to prevent misconnections in order to avoid an injury that could come from administering the wrong gas. Just to give a recap, the American Standard Safety System is used to provide high-pressure connections for large gas cylinders. The Pin Index Safety System is a variation of the ASSS that uses a yoke and pin for connecting small gas cylinders ranging from size AA through size E. And the Diameter Index Safety System is different from the other two because it is used to provide connections for low-pressure outlets that are less than 200. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well because we have a ton of other videos on our channel that I think you will enjoy. Just a reminder, this video is for educational and informational purposes only, but hopefully you can take what you learned and apply it to your career as a respiratory therapist. What topics should we cover next? Let us know down in the comment section below. And if you want to learn even more about this topic, we do have a full guide on our website. I'll drop a link to it right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.